Hello, everyone. How are you? It's Brother Ray here. I hope you're doing well. So, today I have a very special guest on, Dr. Violet McKintosh. Now, Dr. McKintosh is a renowned surgeon and she practiced at the Inglewood Hospital. So, I would like Dr. McKintosh to introduce herself to you before we get into some questions today that can talk about health. So, Dr. McKintosh, can you tell us a little bit about yourself?
Sure. Nice chatting with you, Ray. I was born in Aruba, but I grew
Mm-hmm.
up on a tiny 13 square mile island called Carriacou, which is part of the nation of Grenada. Grenada is made
Mm-hmm.
up of three islands. And I went to high school there, and then I came to America and I did my medical, college, then medical school, and my training,
Mm-hmm.
and all of my practice here. I'm a trained general surgeon who specialized in diseases of the breast.
Mm.
So, breast cancer treatment was my main
Wow.
field of
Right.
practice. Yes. Mhm.
Wow. So today we're seeing that there's a epidemic of cancer on the rise, and I'm so happy
Mhm.
that you're taking the time so that we can make this video to share this information because a lot of people are worried about their health, and a lot of people might have situations where they're not even certain what's going on with their health. So my first question to you today, Dr. Mack, is what are the most important things people can do every day to improve their overall health?
Lifestyle changes.
Mm-hmm.
Science has now shown that most diseases that lead to death,
Mm.
heart disease, stroke, cancer, are all related to our lifestyle. In
Mm-hmm.
the book of Genesis, God, we saw how the creation came about.
Right.
God provided sunlight, He provided water,
Mm-hmm.
He provided the air, and then told us what to eat. And
Right.
these are the main things that we have ignored
Mm-hmm.
for centuries. And now we are really facing a crisis because people are just sick.
Mm-hmm.
We are not following the laws of health.
Wow.
And we watch a lot of celebrities. Some of them try, and others come up with crazy cockamamie
Wow.
ideas, and people flock after
Mm-hmm.
something that sounds good and easy.
Yeah.
But the laws of health include what we put in our mouth or nutrition. We have to exercise.
Mm-hmm.
In the past, people worked, they got up in the morning, they went out, they went into the field to work,
Mm-hmm.
they worked hard.
Yes.
So they got their exercise that way. Most of us are sitting behind a desk for 8 hours every day,
Mm-hmm.
no exercise.
Wow.
And we're not drinking water, we're drinking sodas, we're drinking power drinks.
Mm-hmm.
And these things are a natural disaster.
And they use those power drinks thinking that those power drinks will give energy so
Mhm.
that they can complete the task that they're doing, not knowing that they're causing more harm to their body.
Absolutely. And of course, the people who manufacture these things, they know.
Wow.
They've done the research, they know what happens,
Mm-hmm.
but they're just pushing. Yes, you're going to have increased energy for a short time, but then you have the crash.
Wow.
And in order for you to survive the crash, you may have to drink two more of those
Wow.
instead of the first one you took. So there's a lot of stuff going on, especially in the quote unquote developed countries,
Mm-hmm.
and unfortunately trickling down to the developing countries where we are just doing crazy things to our bodies.
So the main thing that people should be focusing on is on the lifestyle, what they do daily.
Hmm.
I heard someone say that food loads the gun, but lifestyle pulls the trigger.
So, genetics, really, right? We
Genetics.
say, everybody in my family has high blood pressure. Everybody in my family has diabetes.
Mm-hmm.
So it's something genetic. So I don't have a choice. Even when
Ah,
it's genetic,
right.
right? The gun is loaded, but in order to pull the trigger, you have to do something.
Really?
So and it's called epigenetics, your lifestyle can actually cancel what your genetics would have predicted.
So I'm gonna go a little bit off track because what you said is very interesting. Now you were a breast cancer surgeon
Hmm.
in Inglewood Hospital.
Correct.
Now, cancer is an epidemic around the world.
Hmm.
Can people who have cancer reverse their condition by lifestyle?
So we have to keep in mind that cancer grows very slowly.
Mm-hmm.
So by the time a person is diagnosed with cancer, the first cancer cell may have been sitting there for 10 years.
Wow.
Correct. So that now with your lifestyle in trying to reverse that, you may need 10 years for your lifestyle to reverse that cancer. While the lifestyle changes are working,
Mm-hmm.
the cancer can be spreading. So what I often say to my patients, at least let's separate this cancer from your body. Let's take the tumor out.
Mm-hmm.
And then if you want to go and do different things, you can,
Right.
because then you have some time.
Gotcha.
But if you have a tumor that's, 1 inch big, 2.5 centimeters, let's say, the time it would take for the lifestyle changes,
Mm-hmm.
it's going to take a while. Now, there are people who have disease that have spread and there is nothing more the doctors can do. We see big differences then because these
Mm-hmm.
are sort of a few cells scattered about the body.
Mm-hmm.
It's easier to work on that than a big tumor.
Gotcha.
So a big tumor could be millions and millions of cells. Whereas you can have tiny millimeters of scattered about. The lifestyle can help, bring that under control much faster. So you have to be very careful
Right.
when you see people saying, oh, I went on a plant-based diet and in 2 months, everything disappeared.
Mm.
Show us the data to support
yeah.
that. There are a lot of people with what we call anecdotal reports about things happening, and there's no science or studies to support that. So you
Gotcha.
have to be very careful.
Right.
Yes.
Okay. Okay. So here's another one. What common symptom do most people ignore that could signal a bigger health problem?
So one of the common diseases we have is diabetes.
Mm-hmm.
And a person can find that they're very thirsty all the time.
Mm-hmm.
And they go into the bathroom urinating very often. So they're urinating, and because of that, they're getting thirsty, so they have to keep drinking.
Right.
And many of them, instead of drinking water, they're drinking sodas.
Right.
So the sugar in the blood is increasing.
Right.
And it's like a vicious cycle, and they're just ignoring this.
Yeah.
I remember once someone visited my mother and they were telling her that they were having these symptoms. And she said, I think you have diabetes.
Mm-hmm.
Now, the reason she was able to say that is because she had diabetes, not that she was a
Right.
doctor. And sure enough, when that person went to the doctor, they were diagnosed. So do not ignore these types of symptoms.
Mm-hmm.
Symptoms like even itching. They may find that their skin feel itchy. Some people, when they're coming down, when they have diabetes, that's untreated, that may be a symptom.
They start itching.
They may have itchy skin. Now, I'm not quite sure why that is, but it has something to do with the amount of sugar in the blood affecting, the system. People with high blood pressure is called the silent killer. So very often people have no symptoms. But sometimes people may have headaches when the pressure gets really high. So don't ignore things that are not common for you. So you have to be very careful. Things that are
Right.
happening that never happened before, get it checked out. In reality, I think once you pass the age of 35, you really should see a medical doctor and get yourself checked out.
Yeah.
And have a routine. They'll tell you, okay, come back in 2 years, everything is fine. Or come back in a year. Or they may uncover something that you didn't know existed.
Mm-hmm.
So we have to be very careful and very, very intentional about taking care of ourselves.
Yeah.
Too many of us just go through life, just sauntering about as though all is well.
And that's true. Well, my wife is always on me, telling me about my health.
Thank God for wives.
But yes, indeed. But there's something to, I think men don't like to listen to their wives. So sometimes, as a man, we have this strong side. So when we first met, my wife said, talk to Dr. Mack about your situation. My mother was a diabetic. My mother died from diabetes. And my dad had cancer. My dad died from cancer. So when I spoke to you about the A1C test, and my thing was men in general have this fear of going to the doctor. We think we're macho. We don't want to go to the doctor because we think we got it or we can use some kind of bush or herbs and we'll be fine. But I took your advice and I went to the doctor and I got my A1C test done. I got the results, and now I'm much more comfortable knowing what I need to do. So I think you're absolutely on point. When we get to a certain age, we should, you said, I remember what you said. You said that the doctor is your friend. Don't be afraid of the doctor. You know, the funny thing is, I work with a lot of doctors, but I don't like to go to the doctors.
I mean, I know, but even as a doctor, when I go to the doctor, I get nervous. Oh my God, are they going to find something? And I think that's the
Right.
fear most of us have,
Yes.
that the doctor is going to uncover something that's not going to be pleasant. But despite that, you have to power through and go do what you have to do.
Because the results actually help you to realize what you need to change and you catch it earlier than later.
Exactly. So let's say you go to the doctor, they do the blood test, you have a borderline A1C, and they may say you're borderline diabetic. You can turn that around.
Right.
As opposed to going to the doctor, they check your blood sugar is 500. They have to start you on insulin.
Yes.
It's a much, steeper climb to
Right.
reverse that. So you go, they find, your blood pressure is a little elevated. You should cut back on your salt. You need to exercise. You can get things taken care of. Like even cancer, when it's diagnosed early, people hear cancer and they freak out thinking it's a death sentence. But patients, for example, in my field, breast cancer, those patients who are diagnosed at stage 0, stage 1, the cure rate is 95 to 99%. We say 99% because we don't like saying 100% for
Right.
anything. That's a huge difference
That's a big,
than
yeah.
you sit at home, you feel a lump, you say nothing, it starts growing up. By the time you show up to the doctor, you're at stage 3, the chances of a cure are probably down to 50%.
Wow.
So you see, it's a huge difference when things are found early.
Wow. Wow. So now, with that, it leads into my next question. What are the biggest mistakes people make when trying to lose weight or get healthier?
So the problem with losing weight, it's almost like a temporary thing. You go on a crazy diet. The reality is it's not sustainable. So that you say, oh, okay, I'm cutting out whatever. And then after 4 weeks, you say you lost 10 pounds, you feel great. You go out and all around you is the thing you cut out. You have no willpower, you start eating that again. It has a different effect on your body now because, as I always say, the next time you go back and you eat a cracker, you gain 5 pounds.
Wow.
It's more important that you practice eating in a way that is healing to your body. So as you're putting something into your mouth, you say, is this hurting me or is this healing me? So let us say you decide, I am going to watch my nutrition. Let us look and see what they say is the best way to eat. The latest guidelines that came out it's an upside down. It's like, what in the world is it? Makes no sense.
Right. I saw
A few
that.
years ago, they
Yeah.
came out with the healthy, my plate, the healthy plate. And it shows you that 50% of your plate should be vegetables. Right? I used to give to my patient what I called a plant-strong diet or plant-strong way of eating. Using the word diet is a little, because you get into the thing that it's something that's unpleasant, it's something that you have to force, it doesn't really work. But we say plant-strong way of eating. 50% of your plate, vegetables. So it could be a salad plus some sauteed vegetables, some leafy greens, and with some broccoli, cabbage, what have you. 20%, some healthy grains. All right, so you're going to have, let us say you have brown rice, and sometimes you can mix in other grains with that to make it even, more fiber-filled and so on. Another 20%, your legumes, your lentils, your stew peas, your tofu, your all of that. And then a 10%, if you want to say, I want a piece of fish or a piece of chicken, that should be like the garnish on the plate as opposed to the main thing.
Right.
You watch the average plate, 50% of the plate is meat because they have a chicken leg and thigh section together that takes up half of your plate.
Yeah.
Then they have some white rice and a little dollop of vegetables. Whereas you say
Oh.
you have a planned strong plate, you can see 50% is your vegetables, 20% your, as people would say, carbs, which would be your grains, 20% your legumes, and then if you want to, 10%, you can have some chicken or fish,
Yeah.
right? Or if you are vegetarian, then 30% would be the legumes, and the tofu, that would be your protein. And people will say, oh, how much protein? How are you going to get your
Well, I'm glad that
protein?
you brought it up, because that was my follow-up question. So somebody's going to say that. How do they get
So
their
one of the
protein?
problems is you have a lot of people out there telling you you need 1.2 grams of protein per kilogram of weight. So imagine, since 80% of Americans are overweight or obese, right? So let us say
80%.
80%, easy.
Wow.
Because first of all, the guidelines they give you for weight of what's normal, they start off high, okay?
Wow.
So let us say you're 70 kilos, you're relatively normal weight. 70 kilos times, let's say 1.5. So they tell you you need 1.5 grams of protein per kilo. You're looking at 135 grams of protein. It's a lot of protein. A lot of the data suggests that 0.8 grams per kilo per your weight in kilos. So if you're 70 kilos, you're looking at 56 grams of protein. That's much per day. So
That's per day.
Per day. So that's much more manageable. So in the morning, let's say you like doing oats. You do oats that may have 6 grams. You do, let's say you add soy milk to that.
Right.
That's
Some
another.
nuts.
So then you add your nuts,
Right.
your pumpkin seeds. You may even mix in some protein. Like I like mixing in hemp protein. So your breakfast, that could be 21 grams easily.
So that's basically like the amount of protein you need for the day.
No, you need 56.
Oh, you need
So you do
56.
21 for
56.
breakfast.
Gotcha.
And then you just have to come up with 35 more. So let us say you only 2 meals a day. So for your dinner, you work it out. So you have some quinoa, you have tofu, or you do a lentil loaf. That chunk of lentil loaf could be 25 grams. So you can get nobody in America is suffering from protein deficiency.
Really?
No. The majority of people are eating way more protein than they need. You're not a bodybuilder. You're not some, what are these fighters called? You're
UFC
not
fighter.
right.
Right.
You're a regular person. You don't need all of that protein. So that's number one where the problem starts, because
So,
they're overestimating how much protein the average person needs.
so is it a fact that maybe the American diet, people are consuming too much protein?
Well,
Does that protein go somewhere and stay? Because if the body can't process
well,
it.
the body processes it. The kidneys and the whole body has to work very hard to process everything we eat. Some things are much easier to process than others. So what happens with these people, when you eat so much meat, you don't have any space for vegetables. You don't have any space for vegetables. And meat has zero fiber. And that's why there is an increased risk of colon cancer in people who eat a lot of meat, because there's nothing to flush stuff out of the body because you're not eating enough fiber. There's no fiber in meat. So imagine you eat a big steak. You don't have any room for anything else.
Right.
You have no room for a big, you'll eat a little bit of salad, but you don't have room for a massive salad. So it's a lot of things that people have to unlearn, and that the people who are promoting some of the things they're promoting, they have to be honest and really tell people what the truth is.
So let's touch on that a little bit, because I'm sure people are going to ask questions about that. Because since we started this conversation, we talk about the Genesis account, and the Genesis account is more of a plant-based diet.
Correct.
And you mentioned that people are consuming too much meat products. So would you recommend that a plant-based diet is better than a high-dense meat diet?
Well, all the studies have shown that a plant-based diet is associated with better health outcomes across the board. Across the board. Heart disease, stroke, cancer, all the main killers, people on a plant-based diet have a much lower incidence of these killers than those on the carnivore diet, which is a diet they're promoting now.
I
All
see.
these diets cause high cholesterol and all kinds of problems and heart disease.
I see.
So you may
Go ahead.
lose weight. Sometimes they lose weight on with these programs, but then they die young from the results of the program. So people need to do their research.
I saw some influencers promoting something, and I'm like, how can people even think of that as logical? They were actually eating raw meat, and they were saying that that's healthy. To me, that's disgusting. How can you eat raw meat?
People can do anything, but it's just crazy because we saw mad cow disease, right? A lot of meats are contaminated as they go through the whole slaughtering process. Those slaughterhouses are not sterile. So you pick up a piece of meat from a slaughterhouse, that meat may contain a lot of bacteria. So you go and eat that meat raw, and it's the same thing they're promoting with raw milk. Drinking raw milk because they said, oh, they're putting chemicals in them when they pasteurize. When they pasteurize, they just heat the milk to a certain temperature to kill off bacteria, and that's it. And then they cool it back down. No chemicals. So a lot of the influencers are making millions of dollars because if you watch them, they say this thing, and the next thing they're doing, they're promoting some supplement that they're hacking. And when you look at what's in the supplement, it's a lot of the same things that they're talking about that are no good. People can stick to a very simple plant-based diet.
And they'll get all the nutrients they need.
Now, there are certain nutrients that you have to be careful about. One is vitamin B12. A lot of vitamin B12 you could have gotten from the soil in the past. So, for example, you could have pulled up a carrot and just like rinse it off. There'll still be, some of those bacteria that produce this B12. So nowadays, because the way we eat, a lot of people on a plant-based diet may have to supplement B12. Okay, and you can get vegan options of B12 to supplement. You have to be careful about your vitamin D. Vitamin D, especially for those of us who live in the Northeast, in the wintertime, it's dark, it's dreary out, you're not getting that sunlight, your vitamin D levels are going to dip. You need to have it checked, and you may need to supplement. Iron, even. Some people have issues where, you get a lot of iron from red meat, let's say. If you're not eating that, you have to make sure that you're taking in those green leafies that have iron. And sometimes you may need to supplement.
Yeah.
And that's why you have to check yourself. You can't say, oh, I'm on a plant-based diet, I don't need to see a doctor, all is well. You got to check your blood counts occasionally to see where you are to make sure all is well.
So that runs into my next question. So what screening tests or checkups should people prioritize as they get older?
So as we get older, and what you have a family history of. So let's say there's a family history of diabetes. You want to make sure that your blood sugars are running in the normal range. So a fasting blood sugar should be under 100. And then a couple hours after you eat, it should be less than 126, right? Most of the time you go to your doctor, they'll order fasting blood labs. They also should do an A1C, which gives you a view of what your sugars have been running for 3 months. So it's not just a one-up. Oh, I know I'm going for a blood test tomorrow, so I'm not going to eat. They say not for 8 hours, I'm not going to eat for 12 hours. So the number comes in looking normal.
Yeah, and you feel good.
And you feel good. But in reality, your sugars have been on the high side because of this A1C. You may be borderline. You need to check your thyroid functions. You need to check your cholesterol, your lipid profile. And you need to check your B12, your vitamin D. There are other tests as well. You may want to go even further. There are tests for inflammation. There are tests, and a lot of these tests are not routinely done by your primary doctor. In medical school, we got zero nutrition. I think we had maybe one course in nutrition that it wasn't even a full course. So a lot of doctors know about the macros, carbohydrates, how many grams, but in calories per gram. But in terms of actual nutrition, things like inflammation, which are drivers for all kinds of diseases, they're not really trained in that. So there are drivers for inflammation that you can check. Sometimes there are doctors out there, they're called functional doctors, that tend to do a more thorough job in checking things that you would not have thought about. But the standard stuff would be what's called a metabolic panel. It looks at your kidney function, your liver function. Then a lipid panel looks at your cholesterol, triglycerides, etc. And then your thyroid, those types of things. So at a certain age, these are standards that you should have done.
Okay. So we have lifestyle, what you eat, regular checks, and don't be afraid of the doctor. So the question now is, if you could give a clear, listening piece of advice to anyone, how would you recommend that they can prolong their life and have a healthier life? What would it be? How can they do that?
So nowadays, we have no excuse. You can go on YouTube and you look for organizations, people that are credible, not influencers. So, for example,
forget the influencers.
Forget the influencers.
Okay.
They all have ulterior motives. They're selling stuff. It's a grift. Forget about them. There is, on YouTube, you can look up the Physicians Committee for Responsible Medicine, PCRM. And they will talk about different things with the diet, things that you eat, the kind of exercises you need to do, how much water you need to drink, how much minutes you need to spend out in the sun every day. Now, we have this acronym, New Start: nutrition, exercise, water, sunshine, temperance, meaning avoiding things that are bad and eating in moderation things that are good. So just because something is good doesn't mean you need to gorge yourself on them, because it's going to have, opposite effects. Air, you need to breathe fresh air. If you live in the city and you're breathing all of this toxic air, go out to the country, even on the weekend, walk around, take nice deep breaths, wash out the system, rest. One of our biggest problems, we don't get enough rest. Most adults need at least 7 hours every night. Your best sleep would be from 10 p.m. to 2 a.m. So try to get to bed at 9 o'clock. You relax, you unwind. Hopefully by 10 o'clock you fall asleep and you get some solid rest. A lot of us are not getting enough sleep. We're not getting enough rest. Our bodies are not being rebuilt. While you sleep, that's when a lot of things are being restored. So rest is critical. And then trust in God.
Yes.
Because the reality is that you can do everything in your power. It's not a guarantee that you're not going to be hit with some kind of disease.
Right.
Diseases do not come from God. Diseases are a result of sin.
Right.
And God allows things for his own reason. Right. We look at Job.
Right.
Right? Job was covered with boils. He was miserable. God allowed Satan to afflict Job's body so that we can have a witness of how to respond when things happen. And Job said, though he slay me, yet will I trust him.
Amen.
So after you've done all you can, as Donnie McClurkin's song says, you just stand. And if anything comes your way, you have to trust God. When I can't trace your hand, when I don't understand, when I can't see your plan in this situation, I'm going to trust your heart.
Yes. And the Bible also tells us that God himself said, I like the fact that you brought up that about Job, God says, I wish above all things that thou mayest prosper and be in good health.
Yes.
So God wants us to take care of our health. And these simple steps and the advice that you're giving us here today, we can implement them to take care of our health, and to all those who are listening, so that we can have better health. Because as you mentioned, we live in a sinful world, and we all have something. And we don't want what we have. It can be a genetic trait or hereditary trait. Like for example, I mentioned my mom had diabetes. That's a popular one. High blood pressure is a popular one. We don't want these things to escalate into something big. So all the steps that you've given us today can help us to know how we can take care of our bodies. So we should not be afraid of the doctor. We should get regular checks.
Yes.
And we should have more of a plant-based diet.
And start, baby steps.
Baby
For
steps.
some people, you can just do it. You wake up one morning and say, I'm not eating this stuff anymore. And boom, and you never had a problem.
Right.
For other people, it's more of a struggle. But start small.
Right.
Just start eating more vegetables. So I'm going to eat more vegetables. So when I sit down to dinner, I'm going to have more vegetables on my plate. And vegetables can be very filling. So they're filling, your stomach feels fuller sooner. So you're actually taking in less calories. And gradually you'll see a body responding. It took you 10 years to put on the 20 pounds. You're not going to lose 20 pounds in 10 days.
Right.
But when you change your lifestyle and there is a gradual loss of the excess weight, it's more likely that it would be a permanent thing.
Wow.
So people look at being healthy as opposed to trying to lose weight.
Right.
They're going on these crazy fad diets, a waste of time. 90% of the people will gain back all the weight plus more weight.
So start where you are and start small.
You can start small.
Okay. Well, I want to thank Dr. McKintosh for sharing this information with us and our knowledge with us today. I hope that you were blessed. I hope that you learned something of how you can start taking steps to take care of your health. Now, if you have questions, please feel free to put your questions in the comment below. And if by some chance you want to see a part 2 video with Dr. Mack where we can ask more questions, put that in as well. And I can probably arrange that to meet with Dr. Mack again to do a part 2 where we can talk about another topic or go more in depth about health. So remember to subscribe to our channel, be encouraged, and remember, small steps get your health in order, because health is the greatest wealth.
Absolutely.
That's what they said.
Health
Do you have
is
any
wealth.
final words for us, Dr. Mack?
Follow God's plan.
Amen.
Follow God's plan. When you look at creation, God created the things that we need before he created us.
Yes.
He created the sun. He created the plants before he created Adam. He has put everything in place for us. Let us read his word and let us follow his plan.
Amen. Amen. Thank you so much for watching. So until the next time, be blessed. Remember to subscribe, leave a like, and share this video with your family and friends. I'm sure it will help them. And always remember that God is always good.